So hi everyone, my name is Tamara Lotfi. I'm presenting today the e-COVID-19 recommendations map. If you haven't heard of it, today's the day. If you have, please make sure to let us know about your experience so far. So I'm a research associate at HRM, and I'm a year 2 PhD student, HRM Classic. I'm affiliated to the HRM department, WHO Collaborating Center for Infectious Diseases Recommendations and Methods, covering Canada, I'm a great center. And I'd like to acknowledge Professor Holger Schoenemann and the e-COVID-19 RecMap team and collaborators, and Kevin Potty and the Plain Language Recommendations team. So to start, recommendations mapping. Recommendations mapping is something that our team has started working on 2-3 years ago when we launched the WHO ETB recommendations map in response to a request by the WHO Global TB Department in order to have one repository, one place that has all the recommendations related to tuberculosis that were developed by the WHO Global TB Department. Based on that, when the pandemic was announced, we directly started working on developing a similar RecMap, but on a larger scale, the e-COVID-19 recommendations map. So what is a map? How do we present a map? How do we get recommendations into a map? So first, the purpose of the map is to provide decision makers and other stakeholders, patients, healthcare providers, and other stakeholders with an easy to navigate, living, freely accessible electronic platform that includes all available trustworthy COVID-19 recommendations. So really our thinking is just to have a one-stop shop for anything related to COVID-19 recommendations. Moreover, the COVID-19 RecMap allows to identify COVID-19 recommendations, find their critical appraisal, and make them contextualizable, so available for contextualization by decision makers across the globe. Our team is pretty large. As you can see, our global distribution, we have collaborators from across the globe, and we have at least 57 researchers working with us to make this map up and running, sustainable, maintained, up to date. And as you can see, at least 19 countries are contributing to this work. The process for developing the map has multiple components. There's at least 9 working groups that are working together to put everything in its place at the right time. And one of the resources I shared here shows this figure that in details takes you through the different process. But let's take it step by step. First, the question was how to identify COVID-19 guidelines. We collaborated with the Health Information Research Unit at McMaster. We have bibliographic databases that are searched daily, such as, for example, PubMed, Ovid, and searches that are pre-filtered by the HIRO team. They're running APIs and web scraping processes on a daily basis for the ECRI clinical guidelines database, the PAHOBIC database, NICE, WHO, and the CHIN library. We also have monthly searches of great literature sources, CDC, ECDC, PHAC, and additional resources. And just to say that while we have this process in place, when a priority topic comes up or a new critical question is up, we modify the frequency of these searches to make sure we capture the guidelines as soon as they are out. In addition to that, we have our personal contacts with guideline developers. And as I'll mention later, we do reach out to specific guideline developers to make sure we are capturing the guidelines as soon as they are out. What guidelines are eligible to be on the COVID-19 RecMap? First, they have to meet the WHO definition of a guideline. Then they have to be on any form. So they could be new, updated, adapted recommendations with methods or based on earlier guidelines that address any COVID-19 topics. So no restriction to diagnosis or management, addressing any population and without any language restriction. And in order to address different languages, we collaborate globally with teams. We have a big network, and we also work with Corporate Task Exchange to make sure that we are able to translate the different guidelines from different languages. And then we appraise the guidelines that are eligible using the Agree2 tool. If you're not familiar, the Agree2 tool is the most commonly used critical appraisal tool for guidelines. There are multiple varieties within Agree2. There's AgreeRec and different others. The Agree2 so far has been the most tested, and 3 of these of the 6 domains that Agree2 has, so domains 1 through 6, 1 for scope and purpose, 3 for rigor of development, and 6 for editorial processes, were in particular of our interest because, as per previous studies that our team has done, these 3 reflect the most on credibility. And so we decided to appraise those guidelines that are eligible, present the results of domains 1 through 6 on the RecMap, and also continue to appraise the rest of the domains, but we make the results of the rest of the domains available just upon request. The next step was to extract information from the guidelines. As you can imagine, there's tons of guidelines out there. We wanted to extract information to put them on the map. The big question was, how do you extract in a way that is efficient so that the information is available for any future update, any development exercise or contextualization, and not force any duplication of efforts? Because as we all know, extraction takes a lot of time and mainly human resources. So we integrated extraction templates within GradePro. GradePro is, if you're not familiar with it, is a tool for guideline development. And in the past few years, multiple updates have been integrated within GradePro that our team has majorly contributed to in order to make it more flexible, more available for direct development, and multiple other features such as, for example, decision aids and others. So we've integrated the fields that we wanted to push on the RecMap within GradePro and extracted data. We have at least 2 people extracting, or an extractor and a verifier. And once all the information is on GradePro, we push to the RecMap. So I've provided the link to the RecMap in the chat box, covid19.recmap.org. And this is the view when you land on the website. The RecMap is funded by CIHR. And when you go to the homepage, you have the option to see the recommendations in a list view or in a map view. And so the map view has the rows for populations. On the left, you have the population. On top, for the columns, you have the different intents. So is it infection control, vaccination, screening, diagnosis? And if you click on any intent, you'll see different interventions. And so while we're extracting, we provide a code for each recommendation for the population that it covers, and then a code for its intervention, and select a certain intent. And this helps us classify the recommendations, but also this helps us with keeping things living and connecting to other platforms. Moreover, once you're on the map, you can see you have filters, whether you're on the list view or on the map view. The filters help you choose what exactly you're looking for. It helps you specify your search. For example, we have a filter for source, we have a filter for income level, we have a filter for the different components that we've extracted for, as I'll show you in a few. And up until today, so this is from this week, we have retrieved citations for screening, 5,210 guidelines. We have 355 guidelines that have been eligible, that are eligible, that have been appraised and available on the RecMap, which accounts to 4,731 recommendations that are on the RecMap at the moment on COVID-19. If you choose any recommendation on the RecMap, you'll find its agree score on the right. Bear in mind that the Agree2 is a critical appraisal for the guideline, not the recommendation level, but we provide the information there. And then you have the toolbar on the right that allows you to go to the different sections of a recommendation. So any additional information that were provided in with the recommendation text, the evidence decision table, the interactive summary of findings, and source of information or any other important recommendation. Additionally, we link through the recommendation to other portals, such as the Loveport, which is a platform that has all the evidence, which is an evidence database really for primary research and evidence synthesis and others on COVID-19. and it is built by Epistemonicus, in addition to linking to the Norwegian Institute of Public Health's Living Map for systematic views and evidence on COVID-19. One of the major outputs of our work was that we were able to identify and classify different types of actionable statements that are present within a guideline, and this is building on previous work. And you can go to the RecMap and filter to specifically look for what is a good practice statement, an additional guidance, a recommendation, or even a research-only recommendation. Moreover, through the RecMap, if you've identified a recommendation that's responding to a priority topic of yours or a priority question of yours, and you'd like to contextualize it to your context, you can request for a development. So adoption, adaptation, or development. De novo development is a process that allows you to contextualize. By submitting a request here, we provide you with access to the full information of the guideline to help you with the development, and you'll be able to make judgments based on the new evidence that you integrate at a recommendation level for each of the evidence decision table frameworks. And the last point I'd like to add is that we were also able to do, because of the map, we were able to identify whether recommendations addressing a same PICO question were saying the same thing or not. And so the concept of diverging recommendations, and I encourage you to take a look at that. The three major lessons learned were that the map highlights gaps in responding to some priority COVID-19 and topics and multiplicity in others. The recommendations for COVID-19 should be available for a different audience at the time of need, and COVID-19 guidelines are continuously developed, and the RecMap would keep providing support. That statement is missing here. And the last product we're currently working on is the plain language recommendations. So turning a recommendation into plain language in order to allow different audiences to understand and pick up the key messages within a recommendation. And so we have at least 31 plain language recommendations currently available on the RecMap. You can find the filter on the RecMap. You click on available, and then also you can find it next to any recommendation. We're working on translating different PLRs to at least 13 languages. And if you'd like to learn more, you can find more information on our YouTube channel or follow us on Twitter for daily updates. So before I end, I'd just like to thank the big team that is behind the RecMap. And if you have any questions, I'm happy to answer them.